Back pain affects nearly 80% of Americans at some point in their lives. According to Harvard health experts, much of what we believe about back pain is outdated. In this video, we'll reveal 5 surprising truths that could change how you think about and treat back pain. As always, these insights are for educational purposes only. Be sure to talk to your doctor before making any changes to your treatment or health routine. Takeaway 1. Pills are not the first line of defense. Contrary to the impulse to immediately reach for a pain reliever, Harvard experts recommend non-pharmaceutical approaches as the first step for most types of low back pain. Medications are considered secondary options due to their potential side effects and the fact they tend to have only temporary and modest benefits. For acute back pain, that's pain lasting less than 12 weeks, the recommended first-line treatments are heat, massage, acupuncture, and spinal manipulation. And for chronic back pain, the kind that sticks around for 12 weeks or longer, the primary recommendations are even more active: exercise, physical therapy, acupuncture, and mindfulness-based stress reduction programs. Why this shift? 2 big reasons. First, pain medications tend to offer only temporary and modest benefits. They're masking the problem, not fixing it. Second, they come with potential side effects that can sometimes create new problems. Takeaway 2. Movement is medicine, rest is not. Modern medical research shows that movement is actually essential for both preventing and treating back pain. For prevention, Harvard Health is stating that movement is the best way to ward off back pain in the first place. Regular physical activity strengthens your back. The key is focusing on exercises that increase strength, improve your range of motion, and ensure balance on both sides of your body. And if you work a desk job, you need to get up and walk around at least every 30 minutes. That prolonged sitting is absolutely destroying your back. What about when you're already in pain? Even for specific conditions like spinal stenosis, doctors actively encourage people to remain active. One study found that adding just 20 minutes of daily activity helped keep chronic pain from getting worse. This represents a massive paradigm shift in how we think about our backs. Your back is not some fragile, delicate thing that needs to be protected and wrapped in bubble wrap. It's a complex system of muscles, bones, and connective tissue that actually gets stronger and more resilient with appropriate movement and use. Movement is your medicine. Takeaway 3. The cause may remain a mystery. According to Harvard health experts, in many cases, doctors simply can't find a specific cause for back pain. The potential culprits for back pain are incredibly numerous. It could be a simple muscle strain. It could be a protruding disc. It could be degenerative arthritis. It could even be a kidney infection. Physical therapist Christopher Morin explains that finding the exact cause of chronic back pain can be tricky because it could be related to many different factors. The approach, he says, is you may have to experiment until you find something that works. What experts are telling us is to focus on what we can actually control, managing symptoms and improving day-to-day function. Does heat help? Great. Use it. Does a certain exercise routine reduce your pain? Fantastic. Keep doing it. You don't need to know the exact anatomical reason why it works. You just need to know that it works for you. Takeaway 4. Surgery is a rare exception, not a common fix. Many people view surgery as the ultimate fix for persistent back pain, but experts caution that it is useful in a minority of people. It should only be considered after conservative non-surgical options have been thoroughly tried. Most acute back pain, for instance, resolves on its own within 6 to 8 weeks. A critical point is what experts call the imaging trap. Imaging tests like an MRI often show abnormal changes that have nothing to do with the pain. Performing surgery based on these unrelated findings is unlikely to help and perhaps offer no relief. However, Experts note that surgery is most likely to be successful when a person's pain clearly correlates to abnormal findings on an imaging test, like an MRI. Surgery is only necessary in rare cases, such as when a person experiences progressive leg weakness or loses control of bladder or bowel function, which may require prompt intervention. But these are rare exceptions, not the norm. Takeaway 5. Your lifestyle is a powerful treatment tool. Your daily habits have a profound impact on back pain, giving you a powerful set of tools to manage your condition. Experts highlight several key lifestyle factors that can make a significant difference. First, weight loss. If you're carrying excess weight, losing it can decrease pressure on your spine and reduce inflammation. I know weight loss isn't easy, but even modest reductions can make a real difference. Second, strategic daily activity. For managing chronic pain, specific daily goals can be highly effective. A study published in the September 2024 BMJ Open found that adding 20 minutes of moderate to vigorous activity and reducing sedentary time by 40 minutes every day helped keep back pain from getting worse. Third is anti-inflammatory diet. An anti-inflammatory diet rich in antioxidants like polyphenols may help reduce inflammation and prevent flare-ups. We're talking about foods that are staples of the Mediterranean diet. Whole fruits, especially berries, dark green leafy vegetables, nuts, legumes, whole grains, olive oil, flaxseed oil, and fatty fish. What I love about this is that it connects your back health to your overall wellness. You're not just treating a back problem in isolation, you're improving your entire body's health, and your back benefits as a result. It gives you so much more agency and control over your pain through the choices you make every single day. The insights from Harvard health experts paint a clear picture. Effectively managing back pain requires an active, holistic approach. The most effective strategies move beyond the traditional and often ineffective methods of prolonged rest and pills. By embracing movement, trying non-drug therapies first, managing lifestyle factors, and having realistic expectations about diagnoses and surgery, you can take a more empowered role in your journey toward relief. Remember, everyone's situation is unique, so always consult with your healthcare provider before starting any new therapy, exercise program, or making changes to your lifestyle. If you found this video helpful, give it a thumbs up and subscribe. Thanks for watching.